I worked as a security guard in a hospital for a period of time, and then I became a police officer. After several years, I was injured in the line of duty and in and out of hospitals for a year. And at the end of that year, the city retired me as a police officer, and I went to the hospital for a job, and they hired me as a department director in support services. I became close to the chief executive. He became my mentor, in essence, for life. Encouraged me to go back to school and get my postgraduate degree in healthcare administration, which I did. And I then started the progression through healthcare administration, from administrative resident to a vice president position, to senior vice president, executive vice president, ultimately the chief executive officer, and now CEO of a system. We need to go into the community and, be where our patients are, because most of our work should be in the prevention area, not in the let's fix it once it's broken area. We're going to have to rebuild this system, and it's going to be the young healthcare leaders of the future that are probably going to be the ones that come up with the new mechanisms to fix the overall system. You can enter in a doctor's office and be an ambulatory care manager or administrator. You can enter into a large medical group like Scripps Clinic, and there's an array of frontline early management supervisory jobs, be that in imaging or the laboratory, or we even have an internal consulting arm here. When I came to Scripps, I volunteered with the Red Cross, became a Red Cross instructor in CPR and first aid. And again, I got my EMT as well. And so I teach CPR and first aid skills to the non-clinical people, most of them here in the corporate offices. I'm also a reserve commander in the Sheriff's Department, in charge of the Search and Rescue Bureau, and I teach the medical module as well for their academy. And I go out and actually handle calls in the desert for search and rescue, and we deal with a lot of trauma patients out there. And I get this enormous reward, the sense of reward, because I know exactly what our doctors and nurses are facing in the emergency room, because I do it in a different setting. I'm probably the least important person in this organization to the patient. The patient could care less that there's a chief executive sitting in a corporate office somewhere. My job is the health of the organization. If I do my job in the background and I create a motivated workforce and an educated workforce, the quality and the level of care improves, and that's the value.
The nuts and bolts of workforce education is the responsibility of Stephanie Becerra. She's learning leader at Scripps Center for Learning.
Well, in healthcare, you really want to look at retaining the best. When you make a large investment to recruit employees, you really want to have a program at your institution that's going to keep them there. And so Scripps is really committed to continually grooming our employees, to having leadership opportunities, to having training opportunities that will constantly keep them at their best. I completed my graduate work in education, really focusing on instructional design as well as adult learning theory. So it's been a perfect match because the Center for Learning really is looking for individuals that are able to identify how do you create a learning opportunity that's going to meet the unique needs of adults, especially considering the healthcare profession where it's changing constantly. The senior leadership at Scripps is completely behind learning. They really have a vision to make Scripps as an organization an internal university where employees are consistently able to pursue lifelong learning opportunities. That's really essential. Being able to imagine and see what it is that others cannot see, and being able to have that ability to execute, that discipline to make it happen, and the people skills.
This program is brought to you by the American College of Healthcare Executives, an international professional society of more than 30,000 healthcare executives who lead hospitals, healthcare systems, and other healthcare organizations. The leaders of the featured hospitals and health systems are board certified in healthcare management, having become fellows of the American College of Healthcare Executives, signified by the FACHE credential following their names. For more information, go to ache.org.